Hi Akanksha, thank you so
Hello.
much for joining us on this lovely day in Bangalore.
No, my pleasure. Thank you for having me.
Great. And just to begin with, if you can just introduce yourself, what your role at Pinky Promise is, and what does the organization does, and what is the promise that it's keeping?
Yeah, absolutely. So I'm Akanksha Vyas. I'm one of the co-founders at Pinky Promise. I lead technology along with Divya Kamirkar, who is the founder and CEO. Pinky Promise is a digital online clinic for all sexual and reproductive healthcare issues for women. So anybody in India and also the world, any woman who is facing any issue that you would typically go to a gynecologist for, you come to our app, just click a button, and you're instantly connected to a gynecologist over chat. You describe your issues within like 5 to 10 minutes. The doctor understands what's going on with you and gives you a prescription, and then you stay connected with her till you actually feel better and your issue is cured. And all of this is for 99 rupees. And actually, this is possible because we've built out a custom AI platform that actually supports the doctor through this journey, through the triaging, diagnosing, prescription creation, and the follow-up to enable her to be able to focus on what she's really good at and really efficiently be able to care for a large number of patients.
Great, that sounds amazing and a lot complicated as well. Also, to deal with something that's in this range of sexual and reproductive health, where people would actually want to go and physically be with the doctor and consult, and also these issues might be something of secretive, things that they would not want to share over an app, or the data access of the apps that is in question these days. So how do you take care of that? And is there a comparison of how it was being done online, offline, and how the app right now kind of brings in that trust factor while also keeping it safe, secure, and private for these individuals?
That's actually a really, really interesting question. And we've learned some very interesting things along the way in our journey. So even before Pinky Promise started, before we wrote a single line of code, Divya actually pretended to be a chatbot, so on WhatsApp and Facebook groups. So she wrote out a very, very basic protocol on an Excel sheet, and then she copy pasted answers as if a chatbot was asking those on WhatsApp and Facebook groups to answer exactly the question you just asked, right? We are like, this is something that is so private that will people even trust an app or a bot? Will they answer these questions? Will they be willing to commit information? And what we learned is that not only are people willing to commit information, but they are more honest over chat on an app than they are to doctors in person. Because a doctor, no matter how non-judgmental, like if a person is calling you up and asking you these questions, the way that we've been brought up, the way our society is, if somebody asks you, are you sexually active? You will not say yes to that. Whereas on an app where there is somebody faceless on the other side, at least initially, even though you're talking to a doctor, patients tend to be more honest. And there's the kind of issues that patients are coming to us for on Pinky Promise, they do not go to a doctor in person. There's several reasons for that, and I mean, I'm happy to elaborate on those, but they are not going to doctors in person. They are actually Googling their symptoms and self-medicating. And that is the space that we are filling at Pinky Promise. A lot of gynecology traditionally is broken. A lot of issues that are not related to pregnancy, there are not enough doctors and systems and just a social framework to take care of, and that is where we come in.
Great. And like you mentioned that these people are going to Google, and even for me, if I sneeze and I check it on Google, it's cancer probably. It's something that's on the extreme side of it. So with the access to information that people have these days, and the access to information around medical stuff, it's even more complicated, even more nauseous. The more you look into it, the more you kind of look about it. Whereas the interface right now that you built is an app-based thing where the person chats with it. It's very simple, very easy to understand. But on the back end of it, there's a lot that I'm sure goes on. So if you can elaborate on that, and how is that making sure that the data that comes in, feeds in, is accurate and also helpful in real time?
100%. So we've actually built out custom AI at Pinky Promise to do this. So we're not using any of the off-the-shelf solutions. We've worked with, so our medical team has actually curated over 350 top medical protocols globally. Primary research that is India specific, because in certain things the Indian genome is different from the Western genome. Things like our bodies work differently. As well as actually data that we have collected at Pinky Promise over the last year and a half, 2 years, that is completely anonymized, because there is actually a huge data gap in published women's health data in the world. Till 1993, no woman was allowed at any clinical trial anywhere in the world. And even today, for every one article on women's health, there are 10 articles on men's health. So there's a huge bias in the published data. So there's a lot of things that we are learning in our journey that is not even published, that our doctors know, and we have been able to kind of ascertain from the data. So this is sort of like the corpus of information that has gone into training our models. So in our models, like our AI system acts as a guide to the doctor. So information will never go directly to a patient. Everything that comes out of the AI system first goes to a doctor verifies it, vets it, makes sure it's correct, and then forwards it on to the patient.
Nice. And like you said, that there's a really dearth of research in the segment of women and sexual health for women, while there's plethora of it for the other gender. But now that you've collected and started collecting a lot of these, say, data points and value systems on those, do you intend to open it up for others to research and understand from? Is it something that's open source? Is it something that you intend to build on in collaboration with other NGOs?
Yeah, no, so absolutely. I think one of our core objectives in the long run is to be able to create an ecosystem where people can piggyback off the work that we are doing, and we can work with them to just make healthcare better for women. Today, the model is not open source just because it's so new, and so like it's something that we have about a year and a half worth of data. We are also sort of not sure of what that means. I think the first intent is to work with some of our doctors to actually understand what it means and publish, and then kind of go from there.
Great. And just to close off the conversation and to kind of go towards what promise your organization holds for the future. So, what are the plans? What are the promises that you're making to the women, to the fraternity at large?
Yeah. So, I mean, our big promise to every woman in India is that she can get healthcare on her terms at an affordable price, no matter where she is. And our goal in the next 18 months is to reach 1 million users. Make sure that every woman in India has heard of Pinky Promise, and if she's facing any issue, she should not be going to Google or ChatGPT. She should be coming to Pinky Promise, and that we will be able to fix that and like make sure that she feels better. But that is over the next 18 months. I think long term, we are working towards making healthcare for women more proactive, as opposed to like a completely reactive thing that it is today. Like, my mother never goes to a doctor unless she has to. I don't go to a doctor unless I have to. Women in India do not go to doctors. And our goal at Pinky Promise is you come to us and then we'll take care of that for you. We'll make sure you get all the tests at the right time. We'll make sure that you're screened for cancers early. We'll make sure we are going to prevent deaths related to cervical and breast cancer in India, and just make sure that people proactively are living healthier, happier lives.
Great, that's a wholesome promise right there. So thank you so much, Akanksha, for sharing it with us
Thank you
and
for
opening it up to
having
all
me.
those women who require it.
Thank you so much for having me.